are now listening to Extracting Wisdom. Here to help you prevent the decay of your future is your host, Brandon Evert.
Hello, podcast listeners, and thank you so much for tuning in to another episode of Extracting Wisdom. I'm your host, Brandon Evert, and I'm so excited for today's guest for many reasons. It is Extracting Wisdom's first guest from the West Coast, and the first guest I've had on that is a dentist from the Beverly Hills, Hollywood area. So from Glow Modern Dental, we have Dr. Rhonda Kalasho. Dr. Kalasho, thank you so much for taking the time to be on the show tonight.
Well, thank you so much for having me, Brandon.
Absolutely. So right off the bat, I asked all of my guests this question because I feel like everyone has their own unique story or that unique aha moment of when they decided that they are going to pursue dentistry as a career. So what made you choose dentistry?
Yeah, so I was actually born in Baghdad, Iraq. We came to the country in 92. So I remember I was super young and I had immigrant parents that they took care of us. We had 6 kids, but there's a point where you just, the oral hygiene wasn't there. So I found myself at the dentist a lot as a kid, and unfortunately so. But I actually experienced dental pain quite a bit when I was younger. And I felt like I spent a lot of time at the dentist that ever since I was young, I actually wanted to be a dentist. And it was really in college. I started off as a business major.
Okay.
And I was, it's actually pretty good. It really worked well, especially as a practice owner, to be a business major. I then went into double majoring and got molecular biology major, but I was taking an accounting test and I was just snacking on some almonds, and I had an old amalgam filling on my number 3, which is your first molar. Mm-hmm. And I broke that and it hurt so bad. I couldn't even, I was just done. And I went to a cousin of mine who was a dentist, and he got me out of pain that night. And I remember turning around and looking at him and going, "What are you, like God or something?" That was amazing. And it was painless. Just going from such an intense amount of pain to feeling nothing. I thought, what an amazing profession. And then at the same time, dentistry is such a mix of medicine and art and science and business, and it's everything that I liked. So I actually, the next week after my accounting final, I went and applied for a second major in molecular biology. So I graduated, double majored, and it was all miracles from there.
Right. Wow, that's so interesting. That's kind of similar to how, I decided on dentistry, is that same line of thinking where I originally wanted to be a doctor. And when I brought that up to my doctor when I was at a physical for baseball or something in high school, he's like, before you decide on anything, he's like, go shadow a dentist. And, as a doctor, you're either just the, primary care physician or just the radiologist or just the surgeon. But as a dentist, you're all of those things combined. Like you play those roles, on a daily basis. So I really like, how it's such a blend of all those things, like you mentioned.
Yeah, and it absolutely is, especially if you start doing other, if you're doing bread and butter dentistry, I mean, you're still having to check health histories, and you're supposed to know a good background or gather a good background of the patient, because a lot of the medicaments that we use can actually exacerbate some health issues. So and if you're doing implants or you're doing oral surgery, you have to really be familiar with human anatomy, head and neck anatomy, and medicine. So yeah, absolutely. You're a doctor, and at the same time, if you're into the cosmetic realm as I am, you're also some kind of ceramist. So you're just like an artist. I feel blessed every single day when I wake up in the morning, and I love that I'm a dentist, and everybody who's considering it, it truly is one of those fields where if you find yourself having gotten into school or whatever, just consider yourself very lucky. It's a great it's a great field.
Absolutely. Yeah. And I just started my third year in dental school. So I'm seeing patients on a regular basis now. And I'm just, so excited every day to get in the clinic and, help get people out of pain.
So how was it with COVID?
Oh, so what happened was it hit really hard right around March, right around when we were supposed to have our spring break, but our spring break ended up getting extended for about 3 months, basically. We were taking classes online. But starting July 1st is when we got back into school. So now our clinics are only operating at half capacity. We have the full face shields, 2 masks, the whole get up, which is, I'm boiling by the end of an appointment.
Oh yeah. And it's funny how you can actually work in a hypoxic environment. I literally am on 2% oxygen the entire time, but, I know it's nuts.
Yeah.
It's nuts, but I'm so glad you guys are back and working.
Me too.
I know that set you guys back quite a bit. My brother's in med school, so he was doing a lot of his training on Zoom, which is hard when you're, especially as a dentist, your entire life is achieving those clinical skills with your hands.
Right.
So it's like being able to retract a cheek and also hold a drill is honestly a lot of hand-eye coordination and a lot of dexterity. So sooner you can get into someone's mouth and start working, the better. So if you have younger dentists who listen to this show, if there's mission trips that you can take even before you're allowed to work on patients, I would highly suggest you just, if any chance you get to stick your hands in someone's mouth in a reasonable way, not in a freaky way, but you know what I mean. That's just you're allowed to stick, you just do that. You get in there and you just get your elbows in there, because it's really what it comes down to. When people graduate and they're not as speedy, sometimes it's because they just didn't gauge that dexterity early on.
Yeah, absolutely. That's such a great point. And I tell a lot of younger dental students the same thing. It's you got to get over, the stress or the nervousness about working on a live patient for the first time. You just got to get your gloves wet and just get in there, because the more, the sooner you do it and the more confidently you approach it, the better outcome you're going to have for sure.
Yeah. And you want to fight off those nerves. I mean, I remember I was so nervous when I was giving my patient the first IA block, and I was so nervous, and it was, and you could tell, but you want to put yourself in the patient's perspective too, because they're looking at you and you got this giant needle in your hand. You really have to train. My advice to anybody who's nervous is, or who gets nervous doing any of the procedures, is plan it out in your head, the steps, and go and keep doing it over and over again. Even if as minuscule as, I'm going to remove the needle hub, I'm going to put the lidocaine in this room, just step by step. And you will, and if you can get it where it just seems seamless, then you don't have to think about it and you won't be as nervous. And that's the truth also with placing implants. You want to, or extracting a tooth, you want to plan it out in your head and get a good visual.
Absolutely. And we're going to come back to implants for sure in just a couple of minutes, because that is the procedure I'm most interested in. But
I do a lot of that.
Perfect. Okay. Well, I have questions to come. But first of all, you finished undergrad with a business degree and molecular biology. So where did you go to dental school after that?
I went to UCLA, and which I guest speak at occasionally about business fundamentals. So I did speak a couple times at UCLA and also Western and Pomona about business management. My background in business has helped a lot in terms of helping people understand how to get into practice ownership, because I got into owning my practice really quick. I got after my GPR, I was already buying a practice, and then I'm on my second one right now. Okay. So I have gotten into practice ownership really quickly, and to explain that and how to do that especially getting the pearls from someone who's experienced it, is really helpful for people who are wanting to get into practice ownership immediately after school.
Right. So I guess let's dive in a little bit there. So you graduated dental school. Where did you do your GPR? Was that at UCLA too, or did you go somewhere else?
No, I did that one at UC San Diego, which is great because it's a VA hospital. And I really do like VA GPRs. So anybody who also works with me, any associate or anything like that, I always recommend that they, I require it that they do a GPR or an AEGD because those ones, taking that extra year or sometimes even extra 2 years after dental school is really going to allow you to hone in on your skills and gain that speed and that additional experience without hurting yourself financially. You know, like say you get out of dental school where you learn just enough not to kill someone, and then you try to work in a private office. They're going to be like, "Why are you so slow? Pick it up," you know. Right. And you're not going to like it. You're always going to do you're always going to do like a class 2 or a crown. But what if you want to exist in this really competitive environment, you got to be one of those super dentists that does a lot more than that. So, so being able to do more than just crown and bridge and fillings is going to help you so much financially.
Right. Absolutely. Yeah. And I'm actually, speaking of San Diego, I may make my way out there. I'm actually on a Navy scholarship for dental school right now. So
amazing.
I may end up out in San Diego with the Navy, which would be great because
you will love it.
Yeah. I'm so excited. But, kind of along the lines that you were saying, I don't know if I'll end up doing an AEGD or a GPR, but at least those 4 years. So I'm with the Navy. That'll be great practice for speed.
Oh yeah. You'll probably be at Camp Pendleton where they have a great oral surgery, block there. So you're going to get a lot of experience really quick. So you're going to probably love pulling wisdom teeth. You're going to love it. And it's a great training. I like VA type GPRs too, because the patients are not paying for the treatment. Okay. So
right. So the finances are not even.
Yeah. And that's a big deal. That's a really big deal. So these people are generally classed. So they'll get class 1, class 2, class 4, whatever. You'll learn it once you get into a VA system of how they allow some of their patients to get certain treatment. So at a certain class, they're able to even get full mouth implants. Now try to do full mouth implants on somebody in the private sector. They're going to be paying maybe like $30,000,
right?
So, and for the restoration and all the implants and all that. So there isn't going to be much case acceptance in that department. Most likely they'll just start doing like dentures, just regular dentures that are not all on 4 or any of that. But when you are in a GPR or an AGD that's VA based, a lot of the times you're able to actually get a handle on those cases and see them out to completion. And what I liked about the VA in San Diego, and I believe the VA in Long Beach is the same way too, they do it in blocks. So for a couple of months, you're only doing root canals. For a couple of months, you're only doing OS. And then for a couple of months, you're doing pros and restorative. And in that case, you get really good. So I'm really fast at extracting wisdom teeth, even impacted ones. I'm super fast at root canals, even molar endo and through a crown, calcified canals, all of that. So there's very little that I refer out. And I think that VA San Diego is amazing. That's a great, if you can apply there, that'd be great.
Yeah, that's huge. That sounds like you got a lot of good experience.
And you have to find it. Not all GPRs are like that. Don't be afraid to ask.
Absolutely. Okay. So you went to your GPR. Tell us how you decided to start, is it Glow Modern Dental? Is that the name of your practice?
Yeah, Glow Modern Dentistry, yeah.
Perfect. So tell us a little bit about that, like why you wanted to go into private practice and like how you went about your startup.
Yeah. So I actually, when I graduated from the GPR, so when you're in dental school, you're able to take REBS, right? You're able to essentially be able to practice on people right when you graduate if you take the board exam.
Right.
Or alternatively, you don't need to take the board exam and you could take a GPR AGD, and at the end of that, you'll have essential accreditation to practice on people. So I took the REBS, I took the exam. So while I was in GPR, I was actually working Saturdays in private practice.
I see.
So I worked for a whole year, for like 7 days a week.
Oh my gosh.
And I'm telling you, I it would have been hard if I didn't love it. I loved it. But what struck me is private practice is so different. It varies between individual offices. And the one that I was at was great, but at the same time, they were kind of cheaping out on material. They were doing class twos, well, essentially should have been a class two into onlays and inlays. They were kind of over treating the patients. The customer service wasn't there. And I immediately thought, this is not what I want. I want a dental office where people walk in and they know that you're going to give them the best quality of care in the most practical and ethical way. And they're gonna leave happy and healthy, and then in an environment that's really welcoming, where you're treating everybody like you would your own mom, so I wanted to have that kind of environment, and no matter where I searched, if it was in the corporate world, so I also worked corporate for a little bit, and then I worked in private practice. No matter what, it was missing that warmth, that that kind of boutique dental practice environment. So when I started my practice, it's called Glow Modern Dental. So great love of modern dentistry. I love techie stuff. I like, I like iTero. I like CAD/CAM. I like 3D. If you ever follow me on Instagram, I always post about my new favorite is this 3D microscope, which I do my endos through, and it actually has 3D goggles. It's the coolest thing ever. Yeah, it's by Sealer. And the patient can look up and see it on the screen with their 3D goggles, and it looks like the tooth is coming at them, and you're doing a root canal in 3D. It's just cool.
That's cool.
Yeah, it's the coolest thing. I love all that stuff. At the same time, I built a practice where I wanted my team members to also have the same love of dentistry that I have and feel the same way about my patients. And it wasn't hard. It wasn't hard to do. Like, I found a great team. They've been with me since the start, every one of them. And we all have the same motto, that we want to treat everyone like we would our own mothers, so everybody is so heavily cared for. That's why on Yelp we're 5-star, on ZocDoc we're 5-star, on Google we're 5-star. We do all that we can, because understand that dentistry is also a customer service industry. If you're not a really good people person, put someone in the front that is.
Absolutely.
Because this is a whole different, this is a small business. This is kind of different than a doctor's office, because usually people just choose their doctors based on whatever their insurance throws at them. But a lot of people don't have, a lot of people will just find you on Yelp. And so that you want to make sure that you are always offering the best customer service.
Yeah. So, what are some things that you've implemented in your office to make sure that your patients do have like a really nice dental experience and feel relaxed and stress-free? Yeah. So there's a book by Fred Joyle. He wrote, I think it's called It's All Marketing. It's really good. You guys pick it up. Okay. But he says that marketing is defined by, when you're walking into a room, it's the smell, it's the person greeting you. It's all about the brand. So first thing that we did was, when you walk into our office, doesn't feel like you're at a dental office. The music playing isn't this like old, sad, it's not like this muffled radio station in the back. You don't hear the like screams. It's just, it's like we listen to like Avicii, Calvin Harris. It sounds like you are just ready to party in there. Yeah. I like that.
Yeah. It's a lot of fun. So people actually immediately walk in, they're like, okay, that's cool. And then it smells good. Like, it doesn't smell like that dental office. It doesn't smell like IRM. Yeah. I don't know if you've ever walked in. It smells like IRM. Yep. But, so it smells good. We get like sage, what are they? I don't even know what that place is called, but like, my staff always buys those infusers, but it just smells better. And then in the office, it's clean, it's sterile. And we're at this point, especially during COVID, they don't open the door. We actually have a door person that is similar. If you're walking into Rolex, he's in a suit. You walk in and he takes your temperature. And the way he greets you, you just immediately feel like you're royalty. But the best thing is, we don't charge royalty price as well. We're very affordable, and we're very fair. So we also compare our prices around the area and make sure that we are still competitive. It's just the way that you're spending your money. Where are you going to spend your money? And we spend it more towards patient comfort and customer service, and then by extension, quality of care. So that's really, when you come in, it just doesn't feel like a dental office. And people say that. And as soon as you walk in, there's someone greeting you with a smile. It doesn't matter how crappy your day is. I almost feel like I'm a Sunday preacher. You just have to put on a show. You got to smile and just whatever the day has thrown at you. If you're in a really hard extraction 2 doors down and you're doing an exam and you walk over to the exam, you cannot look tired. You put that smile on, like nothing's happening 3 doors down. Yeah, but that's it. I mean, with the way that we just handle it, and we're just so blunt with them too. Like, we just give them great advice. A lot of them follow us on Instagram, so they kind of know us. They feel like they know us and they know our work.
Wow, that's a lot of great advice right there.
Yeah.
So this is what I'm curious about, and another question I have for you. Since you do work in the Hollywood area, what is your patient base like? Do you have, are most of your patients seeking cosmetic care? Do you have a lot of, big celebrities coming to you? Like, what does your patient base look like?
Yeah. I mean, like I mentioned to you earlier when we just kind of chatted before this, we do get a lot of celebrities. And the good thing is I'm not really good at recognizing people. So my staff is, and they're always like, did you know who that was? And because of HIP, I can't say, but yes, we have some pretty high A-listers that show up, but a lot of them refer their friends to us, or, and then it just keeps on going, because I think it's because I don't know who they are. And I don't try to tell them, you want to shout me out on Instagram, and I don't do that, so it's, they just feel comfortable. And we do a lot of the bread and butter dentistry, and a lot of people do their cosmetic work with us. But at the same time, because of my residency background, I still do a lot of extractions. Like today, I pulled out 9 teeth. I placed 2 implants today, and I also set for 9 veneers actually. So okay. I did a lot today. Today was what I would consider my admin day. So that was just my morning. And then the afterwards was just admin, but it's a busy day. And, we do a lot of everything, but you do find that in Hollywood, people automatically assume that you're going to know the best way of prepping a tooth and how you're going to give the most aesthetic value when you're doing a restoration, and rightfully so. So I take so many CE courses. I'm constantly taking classes. I feel like if you really love this field, there's no saying that you know enough. You never know enough. So I constantly am taking classes, if it be about ceramics, dental materials, even dental anatomy. I take them all. But at that, so I do get a lot of patients seeking cosmetic work, and we offer that, but we offer so much more.
So when you do veneers and those type of cosmetic restorations, do you usually do like CAD/CAM restorations, or do you do more like custom porcelain?
Yeah, I do. I like a lot of the custom porcelain stuff, but I also use CAD/CAM. It depends on the patient's bite, really. Right. So whenever you take, if you're taking biomaterials courses, you'll understand the elasticity, thermoplasticity. Different materials will act differently under different pressure. And so say you have a Bruxer patient, meaning somebody who is grinding or even clenching down a lot, and they have low cracks in their teeth. You probably don't want to put porcelain on their front teeth. They will probably just crack it. So you probably want to go with a more, a heavier set ceramic, which are usually CAD/CAM milled. But you have to also work with a ceramist that's exceptional, and even with milled restorations are able to really capture the naturality of a smile, so that you don't throw chiclets in someone's mouth, so it really is. Yeah. It's all dependent on the person. It all depends. It's all case. There's some people who say, I only do porcelain veneers. Like, okay, well, what happens after a year? So, the grinding will not stop. That's usually a parafunctional habit that is always existent with the patient. Even if you were to do Botox or whatever, all those treatments. Those patients are always really hard to deal with. But we do all that. We do pretty advanced cases, and then we do the regular, the veneer cases where it can just be managed with porcelain.
Okay. Wow. Does your office have like an in-house ceramist, or do you use a specific ceramist, or how do you go about that?
Yeah, we do not have an in-office, but he's not far from us. He is our only ceramist, though, that we only work with him. So in that case, he's actually been with me for several years since I graduated. He was the first person I worked with. And over the years, I've gone to his, and if you're a dentist and you're listening to, and you haven't gone to your ceramist's lab, I highly suggest you do. They are an extension of your work, and the most, honestly, people will really value how well you perform the cosmetic work based on your ceramist, because you can prep amazing restorations. You can do great margins, your chamfer, your shoulder, everything looks great. But if a ceramist is giving you these like boxy, thick, not natural looking teeth, no one is going to appreciate you in the cosmetic realm. So you need to really hone in on what is aesthetic, what type of tools they can even use in terms of making some of the restorations look really natural. And so my ceramist and I work hand in hand at all times. He's always on FaceTime with me. If not, I'm at his lab.
Wow, that's awesome. Really cool. Okay, let's get into some implants here, because that is something, I don't know if you know who Dr. Justin Moody is, but he is somewhat of a mentor to me, and I've done an internship with him, and I've taken his course Implant Pathway a couple times.
Yeah, he has a great, I did too.
Oh, you did? You took it?
Yeah.
Oh,
yes.
Okay, awesome. So you know all about Dr. Moody. So what type of implants are you using, and like what's your basic workflow as far as implants?
So, in terms of, wasn't he was just on the Dental Hacks podcast, wasn't he?
I believe so, yes.
Yeah. So, he's great. But so the type of implants that we do at the office, there's so many implants out there. Mm-hmm. I work with a couple of them. So I work with Straumann, I work with Astra, I work with Nobel, and I also work with an implant company called Hyosin. So these are usually commonly, it also depends on what people are placing in the area, because a lot of times I'm not even the one placing it. They'll just find me to do the restoration. So I have inherited a lot of different implant systems, just based on maybe some people oral surgeons referring out to me to do the restoration for them. But they've placed it. So Straumann is what I actually use, and Astra when I was at the VA. And the Nobel is something that I used early on, but I recently started to really take in Hyosin, which I really like too. A lot of these it depends on how it works in your hands. So there are different studies for different implants and how well but really they're across the board. Most implant companies are phenomenal, but it depends on the operator,
right?
And it depends on their. Yes, absolutely. Mm-hmm. That's the biggest thing. It's the placement. It's how much, are you able to attest how much bone density there is? If there isn't enough bone, are you able to really graft it in a way that is actually going to prove itself cosmetic at the end? So, we do so many different ones, and I have on my Instagram a lot of I do like anterior implants too, like a number 8 or a number 9. So we've had a couple of them in this past month. So yeah, and some of them I restored with Nobel. Some of them I've done with Hyosin. So I'm not really particular on an implant type, but I do just have a surgical handiwork that I use across the board.
Okay. So would you say when you're placing implants, are you more fully guided? Will you usually create guides? Do you do it freehand, a mixture of both?
Mm-hmm. When I first started, I was fully guided, and I do have an OP3, which is a CT scan. Mm-hmm. So in the office, so we can essentially do a guided, also using our head scan. Mm-hmm. And you don't really need to have a prosthesis for that, a guided prosthesis for that. After a while, though, I will tell you, I started to freehand a lot more lately, and I think it's it grows from confidence and time.
For
Because
sure.
I remember when I was at the VA, I would be so fascinated with Dr. Gordon, who's the one who taught me how to place implants, how quickly he was able to do it. And at the angulation, he got it and everything looked perfect. And he didn't even need a guide. And I was looking at him like he was some kind of God. It was just, it was amazing. But over time, it really does become almost second nature. You know, you feel the bone, you know, your line of draw, you already know you're going to do the restoration in a certain spot. You know, you just kind of, you just gauge it. But at times, if it really is going to be multiple implants next to each other, I still use a guide, or at least I have a guide fabricated, just to kind of not cause any issues down the line that I could have ultimately just prevented if I got a guide. But I would say for the most part, even my anterior work, I will say, yes, I freehand a lot.
Okay. Wow. That's impressive. That's awesome. It saves you on lab costs, I guess, too.
Yes, it does. But I mean, if ever I'm fearful, or if I think I need a guide, I'll use a guide. But
right.
Yeah.
Awesome. Well, that's super cool that you took implant pathway. I didn't know that. What was your, I guess, your favorite part or your biggest
This was
takeaway?
a couple of years ago.
Okay.
Did he have? So I think it was. I mean, you really have to. It's all about bone.
Right.
So it's all about. So that's the biggest thing that you want to take away with implants. When you're placing an implant, I really love these advertisements that you see, all implants in a day. I don't know what kind of implants they're putting in. I'm wondering. I would just want to be a patient just to kind of go see what kind of, I don't know what they're feeding you. But I would say for the most part, sure, there is an implant that you can place in a day if you're a dentalist,
right?
You know, and if you have enough bone. But usually, like, let's give an example. 2 days ago, is it Monday? Yeah, it was Monday. Somebody was biting on a peach. Okay. And they hit the center of they got the seed and the tooth snapped, and it was his front tooth. It was actually number 10.
Okay.
And it was root canal treated. So you already know that most of the time that's ankylosing. That's really tough to get out. And it was just broken right at the gum line. So we have to, there is some flexibility to bone. Bone is flexible. It's porous. You can kind of ease out a tooth using root tip picks and all that kind of stuff. But by the time I took that thing out, to be able to put an implant in the center of that and have it draw in the direction that you want, and it's an anterior, it's really going to be difficult. And you want to be in solid bone, because if you're in something that's not, it doesn't have rigidity to it, then its stability is highly impacted. Then you can't load it right away. Then it could potentially move as it's healing. There's so many unknowns that could occur. So what I did instead was I grafted the site, and I grafted it very well. And then I essentially closed it up. And then he actually had 2 crowns next to those teeth, which I actually didn't like either. It looked like they cracked a little bit. So I took those 2 crowns off, and I just did a temporary bridge.
Okay.
So he didn't leave with a tooth. He actually left with without a tooth. He actually left with a teeth with a temporary bridge. But even with that temporary bridge, I kind of made it ovate in the center, and just kind of, so it can help heal the gum tissue. And, you know, I've had cases like that in the past. And what'll happen is that you now have created this perfect canvas for an ideal draw for the implant. And then this gum architecture that's really going to give the most aesthetic appearance. I could have easily put an implant in there, but it would have probably looked more, positioned palatally where the bone is, and it would have maybe had an access through the facial and blah, blah. It's just not what kind of dentistry I do. So I just say, really, you got to maintain bone. It's all about bone when it comes to implant. And then once you have enough, you're going to make a perfect implant.
Yeah, that's great advice for sure. Okay, so I have another question that I've been thinking about too. Before this, we were talking about how Forbes named you the most stylish dentist. So I would...
Yeah, what's that about?
Tell me about that. What happened? How did it happen?
Well, I guess it goes back to, I just don't know who's in my chair, right? I have no idea. So we had, I guess, an editor that had an emergency, a lot of pain. I ended up doing some work that was really intensive, but we got him out of pain immediately. It was kind of like what I went through before. And they also had this moment where they wondered, how did that just happen? Like, how did I go from having this intense amount of pain where I couldn't sleep for days, and then this little 5'3" girl just completely, got me out of it. And now I can finally go to bed and then do it in a way where the final restoration, I think that was the topper. It was the final restoration. When I pull back the cheek and I asked them, how do you like it, before I cement it? She pointed to a different tooth and said, oh yeah, that's nice. And I said, no, it's the one next. They don't even know the difference between, and you just captured that natural appearance. You got the shade, you got the size, the bite just felt like butter. It just felt so good. And then they just look at you and they go, you know what, there's something special here, and they felt it in the environment too. Cause they say they've gone to a lot of dentists and the dentist looks so unhappy. I don't know. She was kind of, some people just have this idea of how dentists are, but we come in perky, smiley, dressed up, looking nice. Our hair is well done. And especially, but now in COVID, we look like garbage, but before then, now, I'm like, you don't even know the difference between me and my hygiene. We all look the same. We're like mushrooms.
Oh yeah. You can't tell anybody apart anymore.
No, I saw a really funny meme of a doctor that put George Clooney on his shirt and somebody else put Angelina Jolie. I could put we just look awful right now. But at that time we looked relatively normal. And I think when all this is over and done, we'll probably hopefully go back to where we were before. But, I just kind of always made sure even my staff always looked good. The office always looked good. It's also about the appearance. It's about branding, and branding could be a whole different podcast in itself. Branding is the biggest thing about dentistry because, like I said, it's customer service, and the way that you brand yourself and your office and your staff and the work that you do, all of that comes together and encircles your practice, and it really defines who you are and the kind of work that you do.
So the person in your chair, then they worked for Forbes? Is that what happened?
Yes.
Okay.
Then they're like, oh, I'm going to write about you. And I said, okay. I just didn't know it was for Forbes.
Wow.
So I thought it was like some local magazine.
Right.
So it was actually nice, so I did it. And then I've been in other ones like Allure Magazine, MSN, Eat This, and all these other brands these other magazines will ask me for my dental advice and all that. And I think it comes from also being where I'm located. A lot of people, I do serve a lot of producers, writers, actors, a lot of people on it. Netflix is just down the street from me, as well as Hollywood Studio Lot. So I get a lot of people just maybe on their break, maybe wanting a whitening, but they're shooting a couple scenes of what maybe one of your favorite episodes. So we just get such a wide range of people that sit in our chair, and we just don't know what their connections are or whatever. But it wouldn't matter. It doesn't matter if you are an A-lister or if you're just a mom that was just a regular person. You're going to be treated exactly the same way. And that's really what we stress, and people feel that way. Everybody feels like an A-lister when they come in. They get water, they get this cool music, they get individualized treatment. It's just great.
I think that's the pearl right there of that episode, is that, you treat every single person or patient, totally the same, regardless of status and whatever. And you try to make every single patient feel like an A-lister. I think you said that really, really well.
Yep, absolutely. There you go.
That's awesome.
Yeah.
So we can start wrapping up the podcast here, but I'm going to put you on the spot. Do you have any pieces of advice? I know you've shared several, but anything else to share to either dental students or new dentists? Anything else that you'd like to add?
I think for dental students, if you are going to go into practice ownership, I would highly suggest that you do additional training after school, because it's really competitive out there. It's practice ownership is very, very, very difficult, but it's so much fun. but I would still recommend that you just advance your educational background a little bit more. I do get a lot of people sending me resumes if they want to associate. But the fresh out of dental schools sometimes don't get as much background in terms of root canals and implant placements, like, and extractions, where you will find, even this is for dentists as well, where you will find a lot of your income, or at least maybe you have a really slow day, but you get an emergency case. That emergency case, for the most part, is going to be a root canal, or it's going to be an extraction. And if you're referring that out, then that's lost production, that's lost income. What I would really recommend is that you get good at doing some extractions, that you get good at doing root canals. It's going to save you and your practice a lot, especially on those slow days where you have to reach your practice numbers, and you just don't want to be nickel and diming people and doing crowns when you don't need to. Just learn your additional experience, so you get really good at doing other things, and so you're able to offer more things and increase that production.
That's fantastic advice. Well, Dr. Kalasho, thank you so much for taking the time to be on the podcast tonight. I really appreciate having somebody of your caliber on the podcast. I think tons of dental students and new dentists and any dentist, really, anybody who appreciates dentistry can really take something away from this episode. So I really appreciate it.
Absolutely. If you guys need anything, just shoot me an email, or you can reach me out on my Instagram. It's at Dr.Rhonda Kalasho.
Perfect.
And it's Dr.Rhonda Kalasho. And you can just send me any questions there. I do get a lot of inquiries, and I'm really good about answering them.
Excellent. Okay. Well, I actually just followed you this morning, so we can stay in touch.
Yeah, we could. I like your pictures. You like mine. We'll spam each other.
All right, that sounds good to me. Dr. Rhonda, thank you so much. You have a good rest of your night.
Thank you, Brandon. Thank you so much. Have a great night.
Thank you. You too.
Thank you.